Hello, and welcome to Let's Talk, a Tulsa World virtual town hall meeting. I'm Wayne Greene, editorial pages editor of the Tulsa World. Today's town hall is graciously underwritten by the George Kaiser Family Foundation. Today we're going to be talking about the COVID-19 pandemic and its impact on incarceration in our state with former Oklahoma Speaker of the House, Kris Steele, who is Executive Director of Oklahomans for Criminal Justice Reform, and with Tulsa County Sheriff Vic Regalado, who runs the largest jail in northeastern Oklahoma, the David L. Moss Criminal Justice Center. Welcome to both of you.
Glad to be here.
We asked the readers what questions they'd like to see us ask today, and I want to get to as many of those as possible. Speaker Steele, I wonder if you could start us out by giving a short description of Oklahoma's prison situation before the COVID-19 epidemic. Most of our readers are familiar with the fact that Oklahoma has the highest incarceration, or among the highest incarceration rates in the nation. What are the implications of that fact for our state budget, for the workforce, and for the crime rate?
Absolutely. And Wayne, thank you so much for the opportunity to participate in this virtual town hall and for the opportunity to join the discussion today. Sheriff, it's great to be with you as well.
Good to see you.
Thank you. I would just start off by saying prior to the pandemic, the Oklahoma prison population stood at 109% capacity. That means that we are having to be very creative and bring in beds where beds should not be. We're having to overpopulate prison cells, and there's just absolutely no room to practice any kind of social distancing. The reality is that the prison population in Oklahoma is out of proportion compared to the rest of the nation. We incarcerate female offenders, for example, at 2.5 times the national average per capita. It continues to be a drain on our state budget. This current fiscal year, the Department of Corrections received a $623 million appropriation. That's a record high. And the reality is it's probably not nearly enough to adequately meet the needs and actually engage in corrections for the number of people who are in Oklahoma's carceral system. When we're simply warehousing people in environments that are antisocial, it does not promote public safety. Instead, it tends to make the situation much worse and increase the likelihood that a person will reoffend once they pay their debt and finish their sentence.
Have we seen COVID-19 behind the walls yet? And how does that complicate the bad situation that's already there?
We have, and so we know that there are at least 2 confirmed cases on the inside among the offender population. In addition to that, as of last week, at least 9 correctional officers who are coming in and out of facilities have tested positive for COVID. And the reality is we are not engaging in widespread testing within our prison system, so we don't know exactly what the magnitude of the situation is. We do know what has happened in other states, and because we are not testing nearly as adequately as we should, and because the numbers are what they are in Oklahoma within the population, I think it's a very scary situation. I think it's a situation that could get out of hand in a heartbeat.
So just to pull that all together, we have a confined population, largely untested, that is being served, for lack of a better verb, by a population that goes in and out of the prison system, and so potentially carries whatever's going around inside back home to their families and to innocents.
There's no doubt about it, and just to underscore that, and I'm not trying to be critical, I'm just stating the reality. Prisons and jails tend to be petri dishes for a pandemic like this to spread and to get out of hand. I mean, there's just really no way to control an infection or a disease like this in the situation, in the environment that exists within our prison system and in our jail situation. A very close example is that in Texas County, there was an outbreak that got out of control. It did spill out into the community, and the hospital systems in Texas County, in Texas County, are just completely overwhelmed because of the outbreak that occurred inside that area's incarceration facility.
So, Sheriff Regalado, good morning, first of all.
Morning.
Thank you for joining us. You have a different population, right? Most of your people are either serving misdemeanor sentences or are awaiting trial. They've been convicted of, have not been convicted of whatever has them in jail in the first place, which puts a different face on it to a certain extent. What's been the COVID-19 situation at Tulsa Jail, and what are your plans for dealing with an outbreak there if it would happen?
Okay, well, thank you for having me, and certainly appreciate being here with former Speaker Kris Steele. First and foremost, yeah, our population is comprised of individuals that are serving state misdemeanor sentences. They're awaiting extradition to DOC, and they've also been arrested on felony charges and are awaiting either bond or court dates. Our population as of today is 1,109 inmates within our jail, which is has been a steady increase from the beginning of the COVID pandemic, where we were able to get to an all-time low of about 952, somewhere in there. So it's been on the increase. And I think as opposed to many of the jails across the country, as well as prisons, we've been very fortunate in that we have yet to have a single positive COVID-19 case among our inmate population. And I believe that's for two reasons. One, we implemented our COVID response plan almost immediately. We did not wait to see if it was going to hit Oklahoma or the United States. Once we got wind of this and the potential that it was going to spread into our country, we began formalizing a plan and implemented it almost immediately. And that was comprised of ensuring that we had the proper PPEs for not only our staff, but available to our inmate population, that we educated through posters and otherwise on sanitary precautions, washing your hands, attempting to social distance as much as you can in a jail setting, which is near impossible, as the speaker mentioned just a little bit ago. And then we evolved from there. We now have safety pods. So when an individual is arrested, they come in, they're provided a mask, and then they're placed into a 14-day observation pod, which we have now equipped with mental health practitioner to ensure not only the physical, but the mental well-being of those inmates that are in quarantine in those safety pods for 14 days. And that seemed to really, be a big component of our plan, because we were able to isolate that outside influence from the general population that was already in BLM. And now we have implemented widespread testing within the jail. We're now starting with new intakes so that we can lessen their time in quarantine and move them to the general population. And then we hope to continue that testing so that we have at some point tested every inmate within the BLM, which is significant because although we do daily temperature testing morning, noon, and night, anybody entering in has to have their temperature taken. What we hope to identify through this mass testing is those that are asymptomatic and be able to isolate them from the population and do that COVID infection tracking and see what pod is that asymptomatic positive person in, and then start that testing and isolating those individuals. And that goes along with how we would contain and slow widespread infection. And we've been able to do that. And although we haven't had inmates tested positive as of yet, we have had a couple of employees, and one was a chaplain's assistant. Fortunately, we were able to, she was able to identify that very quickly, and she was in self-quarantine, is now recovering. And then the other was, I believe, another clerk, which would be somebody that's not in the general vicinity of our secure part of the jail, but nonetheless works in the jail. And they too also were able to catch it very quickly and isolate themselves, and they are also have recovered and returned to work as of not too long ago. So we've been very fortunate, and I do think that luck has also shined on us, and we take that every day. But you know, we're not sitting here and patting ourselves on the back and saying, well, we've been able to avoid it thus far, and I think we're in the clear. We have a long ways to go in regards to the COVID-19, I believe. And the jail is a tricky situation because, and I likened it at the very beginning of this to a cruise ship, and where you have a big population in a very small area, which is rife for the spread of a pandemic. You know, so we continue to do things that we started very early on, and we hopefully will, you know, on the best side of things, we won't have a COVID-19 infection, and on the worst side, we will, and we'll be able to contain it. Because what we don't want to do is have that spread throughout our jail and then flood into the hospitals. And although that we are in a position here in Tulsa to accommodate that, we don't know what the future brings in regards to this pandemic. If we have a second wave, we certainly don't want to take those beds from our citizens for inmates that are in our jail. So again, we've been very fortunate, but I think the key was early implementation of our COVID-19 plan.
The early implementation, and the other big advantage it sounds like you have over the prison system is that you're operating within your defined capacity, so that you have the space, the cells to isolate people before you know whether or not they're infectious or not, and to do the job right.
We do, but understand this, that all of that goes to the wayward side if our population continues to increase. You know, if we can control that, wonderful. But again, just in the last 2 months, we are on a steady incline in our jail population. And if we get to a point where we cannot operate safety pods, then that goes to the side. And that's why we were very insistent on getting testing so that we could shorten that period of time in those isolation pods. And so far we've been on track in the implementation of our short-term, mid-term, and long-term plans to deal with the COVID-19 crisis. And so far, again, with a little bit of luck tossed in, we've been able to do that.
Speaker Steele, what options does the state have to try to manage the pandemic's potential within the prison system better than it has?
Sure. So I want to note a couple of things. When you asked originally at the top of the discussion, you know, what was the dynamics within the prison population pre-COVID-19? The reality is when this pandemic hit, our prison population was at 109% capacity. Today, we are at 103% capacity. We've actually seen a slight reduction in the overall prison population. That's because of a couple of reasons. One, the Department of Corrections has stopped transfers. So if a person is being held in a county jail that is waiting to be placed in the Department of Corrections custody, that person continues to wait. They've stopped all transfers into the Department of Corrections as a safety precaution. They've also limited visitation. So individuals who are currently in a DOC facility they're not allowed to have visitation like they normally would on the weekends or the holidays at special times from their friends or family. They've instituted lockdowns in many cases so that the population is not able to be out of their jail cells and in with other individuals in common areas. They've really limited that practice. And then on the front side, we've seen fewer arrests. So law enforcement, police forces and sheriff's departments have really taken steps to determine when an infraction occurs, if the person should be taken into custody or if the person could be given a citation and remain in the community to sort of minimize the risk of those who would be entering the facility itself. Courts have put on hold many cases that are waiting to be tried, and so on and so forth. They've also started to allow hand sanitizer, which contains alcohol, to be utilized more prevalently within the prison system itself. Previous to COVID-19, that was not allowed. That was against the rules to have an alcohol-based hand sanitizer, but they're now allowing that. They've also provided some masks to individuals to wear while they're trying to manage the situation. But I just want to go back and say that while these steps I think are necessary and important to minimize the spread of COVID-19, these reforms do come with a price. It's isolation and being lonely and being cut off from the support that you have in the community can really affect a person's emotional and mental state. Across the state of Oklahoma, we are actually seeing an increase in the number of suicide and suicide attempts. And the reality is that when people are completely isolated and completely cut off, it's hard enough as it is. And then when you have all of your support system taken away, it's a necessary evil. It can really have an effect on the mental, emotional well-being of an individual. And so I just want to point that out. But I want to be fair to the Department of Corrections. I think within the situation, they are doing the very best that they can to try to minimize and take appropriate precautions to protect the health and well-being of those who are there, the physical health of those who are there. The final thing that I would say, and this is actually taking place tomorrow, is very, very timely, but the Pardon and Parole Board is actually having a special meeting to consider the medical release of individuals who are medically vulnerable within the Department of Corrections to try to expedite their return home and get them out of the situation. So there's already criteria in place that if a person has medical conditions that should be taken into account that may render that person extremely vulnerable, or because of the medical situation, he or she is no longer considered to be a threat or a danger or a risk to public safety. There's a process in place to expedite the release of those individuals. And the Pardon and Parole Board has actually taken an extraordinary measure tomorrow to have a special meeting just for that population to expedite those releases, which I think is a very positive step.
Sheriff Regalado, has the pandemic resulted in any changes in crime patterns? Are you seeing more of some crimes and less of others? I think about my own circumstances. I'm in my home 23 hours a day. I'm a very poor burglary target at the moment, but we read in the paper that at least about concerns about more domestic violence coming out of the close confinement of families. But what are you seeing in terms of your intake, and has the pandemic resulted in any sort of policy shifts in what you're telling your deputies and what TPD is telling their officers to do in terms of enforcement?
Sure. And again, we're in when this first started, we were all in uncharted waters, and so I think at the time, what we stressed was the discretionary part of our jobs. Taking into mind that we still have an obligation to enforce the law, regardless of whether the pandemic was occurring or not. And before I go any further, I would be remiss if I didn't thank our first responders and our detention staff for what they do, because I think we've all agreed that there is a risk, especially during the COVID-19, that we still have detention officers that still have to show up and guard and secure the inmates of Tulsa County. And we have first responders that don't have the luxury of telework. They still have to return and answer calls for service, placing themselves and, more importantly, their families at risk. So I want to thank them very much for their dedication. But moving forward, at the beginning of this, we asked our deputies to be discretionary in terms of, if a ticket could be provided in lieu of arrest, let's do that. Let's use discretion in terms of who we were arresting, and was it something that was a risk of public safety if we did not make that arrest, or is it something that we could accomplish later through an out of custody affidavit? Things like that. But as we continue on, what we have seen is that, especially in terms of what has increased as a direct result of COVID-19, I think if you look at traffic accidents, I know that my colleagues at the Tulsa Police Department have seen an increase in traffic accidents and traffic violations. We've had numerous reports from citizens, more so than in the past, about a total disregard for speed, as well as lights and all those things. And you can directly really attribute that to the beginning when there was a fear for our first responders in terms of personal contact that occurs during traffic stops. And so we saw a drop in terms of how we enforce traffic laws for a time being. And as a direct result, I think that we saw that increase in traffic deaths. And that's a concern, So there was, again, it seems like traffic laws are really not that big of a deal in the grand scheme of things, unless you focus it and understand that across the country, traffic violations account for thousands of deaths of our American citizens. So, there was a little change there. And what we're starting to see now is, again, I think the speaker mentioned that we've seen an increase in suicide attempts, not only in the county, in the unincorporated area where Tulsa County patrols, but in the city as well. And that's concerning, and I think can also be attributed to the COVID-19 and the quarantine that we've all had to endure. Domestic violence is up. However, what we did see at the beginning of this was a decrease in calls for domestic violence, as well as applications for violation of protective orders, which is concerning to me because it either says that for whatever reason during the quarantine, domestic violence all of a sudden decreased, or it's just not being reported. And I tend to believe the latter. I think that unfortunately, the offender and the victim are housed and do not have the ability to leave or the resources in which to contact the law or Family Safety Center to report those crimes. So I'm very concerned over that. And I hope that, we've attempted to, through daily briefings, and since this has started, to educate people about how to go about getting a violation protected order, how to call the police in the event of domestic violence. So we're trying to head that off, but unfortunately we've seen an increase in that as well. So there have been some things. Violent crime is starting to tick upwards, but usually around this time we see that. We've had several murders within the city, and this is usually the time where we see an uptick. So it's difficult to say whether or not that is a direct result of the COVID-19 quarantine, or it's simply that time of the year. But again, there's difficulties in responding to those. We still have a pandemic. And so I think that, altogether, I would remind people that, we are still enforcing the law. As we reopen, we anticipate some of the crimes such as larcenies and burglaries start to increase again because they fell during the quarantine. And that's easy to surmise. It's because businesses were closed and people were home. So it makes it difficult to burglarize a crowded residence. So we anticipate those will start to increase as we reopen Tulsa and continue to move forward. So again, we are reminding people to be vigilant, to understand we're still available for calls for service, But we've asked that certain things take place so that we can not only protect our citizens, but our first responders. Simple things like saying when they call for a 911 dispatch to inform them that somebody within their residence is either COVID-19 or symptomatic, so that we can take the time to put on the appropriate gear. And so, simple things like that, I think we can continue to see a downward trend and start to reopen a little more safely.
Do your deputies have the N95 masks available if they're going into a situation that they're unsure of?
They absolutely do. They're equipped with all the PPEs, which brings up another point I would like to add and inform the public. Is at the beginning of this, we knew that masks and especially the N95s and hand sanitizer would be in great demand. Well, we are still awaiting orders for hand sanitizer and masks that we put in 2 months ago, and we keep hearing how those things are readily available. And I'm sure they are, just not to law enforcement agencies. And so I'd like to bring that up. And what that did, it forced us to kind of think outside the box. So what we did, as opposed to being able to order hand sanitizers, we ordered the components of them, and then we mixed it ourselves and made our own hand sanitizer. It's things like that we were forced to do because of the difficulties in obtaining PPEs for our first responders. And I would also like to thank our private and public sector. They really stepped up in terms of getting us masks and hand sanitizer and really allowing us to get through the meat of this pandemic. And hopefully, as we move forward, those orders will come in and we can utilize them to, again, safely serve the public, not only out on the streets, but within the jail.
Speaker Steele, you made reference to the parole board moving forward with the commutations and with medical releases. One reader, apropos to that, asked, why would we let prisoners out if a face mask is all they need? Why not just give them a face mask and send them back to their bunk?
Well, the reality is a face mask in and of itself is not going to stop the spread of COVID-19, an infection or a disease or virus like this. And we are incarcerating too many people in the state of Oklahoma. We have to remember that even though a person has made a mistake and been caught and convicted of that mistake, they are still a human being. They're still a fellow Oklahoman. There's still a life that matters in the state of Oklahoma. They do not become subhuman at that point. And we need to treat them like fellow Oklahomans, like the human beings that they are. I think that when we're talking about public safety and what's in the best interest of public safety, that includes everyone. And if a person is deemed to be safe and can be safely transitioned out of a very serious at-risk environment into a safer environment, that ultimately puts us all on more solid footing from a public safety standpoint. And so at the end of the day, I think it's important that we remember that we can still hold people accountable in the community. I mean, punishment is not the only, punishment is not accountability. And so if there are ways that we can ensure accountability that would ultimately lead to greater public safety, I think that we should absolutely consider those measures and do everything we can to achieve those goals.
Sheriff Regalado, several readers wanted to know if the pandemic changes the county's involvement in any way with the federal 287G program. So first of all, give us some background. Tell us what we're talking about with 287G, and have any of your 287G detainees tested positive, and are you changing your response in that situation any because of this situation?
Sure. First, I think it's important that for those that don't understand the distinction between the 287G and our housing contract with ICE. So 287G in its simplest definition is if you are here in Tulsa and you are an undocumented individual and you have committed a crime and an arresting agency, whether it's Tulsa County, TPD, Owasso, Broken Arrow, has arrested you and brings you to our jail. We have ICE detention officers that determine whether you are here as a citizen or undocumented individual. If it's determined through that questions and investigation that you're here undocumented, then you are still arrested on the charge in which you were initially arrested by the agency, but a detainer is placed on you to ensure that you, after you have dealt with your local charges, will now bridge over into ICE custody, at which time you will be afforded immigration court and things like that. The ICE contract in which we have with ICE is simply a housing contract. So we have individuals in our jail that we house for ICE that are seeking asylum, deportation, or awaiting immigration court. That particular partnership has really declined over the last 4 years. In fact, today's ICE contract population is 22 people, to which none have tested positive or brought to our jail with positive 19 tests. Now, 287G, okay, are over since March 1, and that's declined since the pandemic as well, just like the arrest did at the beginning. But to put this into perspective, people, from March 1 of 2020 to May 11th, 2020, we've had 30 individuals arrested for felony charges and had 287G detainers placed on them. Now, contrary to the misinformation that is typically spread about it, they do not have people, we do not, of those 30, none of them are in our jail with traffic charges. In fact, they are at the other end of the spectrum. They comprise felony charges such as lewd molestation, assault with a dangerous weapon, domestic strangulations, drug trafficking, and so forth and so on. There are none in there who have a detainer placed on them for a misdemeanor crime. The lowest crime on there, and I put quotes on the lowest, is an individual who was arrested for public intox and assault and battery on a police officer. So these are individuals that are committing crimes that affect our community. And so when people ask me, are you going to get rid of 287G? The answer is an uncategorically no, okay? Because this is about crime. Now, you know, and this is probably not the form and nor do we have the time, but I would say that oftentimes people would mix 287G with the overall issues of immigration in our country, to which I believe absolutely that there has to be some kind of reform. But that's going to take bipartisan partnership, and that's not going to happen. It hasn't happened for decades prior to today, and it's not going to happen for decades from here on out until we've dropped the political part of that. And unfortunately, politics really rears its ugly head in things that are most important to this country, and that's unfortunate. But nonetheless, again, this is about the criminal component, not about people coming here to make a better life for themselves and their children and escaping prosecution or tyranny in the countries in which they came from. These are about people that are coming here and, again, committing felony violent crime. And so, no, I won't be getting rid of 287G. Now, our ICE housing contract, that is, you know, we, like any other vendor, we look at those contracts and we have to determine, is this something that is beneficial to the people in which we are performing that job for? Is it beneficial to the jail overall? And is it beneficial to the citizens in which we serve? And I would tell you that, you know, we are considering getting rid of the ICE housing contract because, quite frankly, it has gone down to all-time lows. We're talking 22 people, and from when I first started here, we had close to 100. You know, so Apparently, we're not needed in regards to that housing. And again, in the event we have a spike in our inmate population from our homegrown Tulsa citizens, then we can certainly use the pod space, because for 22 individuals, having a pod open for that just simply doesn't make sense. So we're evaluating that as always, and we'll make a determination on that in the near future.
Help me understand the distinction you just made. The 287G is the process for distinguishing people who are brought in from whatever agency who don't have a legal status in the United States, and therefore are flagged for ICE consideration. The ICE housing program would be what would potentially follow from that, the holding of those people while they're run through immigration court, or I guess criminal court.
So they're still held in the general population until their local charges have either been, and again through agreement with the district attorney's office, have either been dismissed because this is an individual that is more than likely going to be deported. So for the sake of judicial efficiency, they would be deported and taken away from our communities. Secondly, yes, when they do bridge and they've handled that, their local charges, they do bridge into our ICE housing contract. But I would remind you that we're no longer are the only housing contract here in the Tulsa vicinity. Many of them, I surmise, are going to the Oklahoma facility or elsewhere, but they're not coming to, for whatever reason, to Tulsa County. And I say that because we have inquired why the sudden dip in our population, our housing unit population. And I tell you, we've never gotten a solid reason from the government as to why that's happening.
So you could continue operating the 287G program without the ICE housing.
Correct.
Okay.
Correct.
Okay, gentlemen, again, thank you for being with us today. I want to give each of you an opportunity to say anything that you have in your mind that hasn't come out so far. And let's start with you, Sheriff Regalado.
Okay, I would just like to say, first and foremost, there's been talk about prison population and jail populations, and being able to provide a different avenue rather than incarceration. And I wholeheartedly believe that. I think there are opportunities that we are currently working on, and being able to address that portion of the prison population that are there because of substance abuse and mental health issues. Okay, there absolutely are those people in our prison system that are there because as a base cause of mental health and substance abuse. And I absolutely believe that there are solutions to that in regards of treatment and providing solution or plans for them to re-enter into society, or hopefully not even go that route with proper treatment. The problem is that we've talked about it, but we never actually take those steps and to fund those type of operations. Today, the fact is that law enforcement has done an outstanding job of identifying those suffering from substance abuse and mental health issues. We have educated ourselves in how to interact with those individuals, but guess what? At the end of the day, we still have nowhere to take them. And I think that is an absolute travesty, because when you have people saying, oh, the prison population is overflowing and people need help, there's never a plan in which to address that. And we've come up with some things and conjecture and all those things that never come to fruition. It never comes to fruition. And so what I would say is that we have to bring a complete and total common sense approach. There is a place for punishment. If you commit violent crimes, and there are those that will commit them regardless of what you do for them and provide them. That's just a fact. And they need to be in prison. But in terms of individuals who have suffered through substance abuse and mental health issues, well, we need to provide for them as well. And I think it's going to take a total cultural change. We have to find a way to get that pendulum from swinging so far to the left and then so far to the right, but somehow land it in the middle. And it can be done, but as I mentioned earlier, we continue to politicize this thing, and we continue to have knee-jerk reactions to complex problems from our legislators that never work. And instead, if we can somehow come together, figure out what's best, and safety should be first and foremost. As the speaker said, yes, our prison population are individuals that have come from our communities. And do we have an obligation to protect and incarcerate and treat and reform? Absolutely we do. But you know what? Especially since we're talking about the COVID, let's not create a public safety crisis on top of the public health crisis. There is a way to do it with common sense. And what we have seen is in LA County and in New York City, where they just blanket let thousands of inmates out with violent criminal histories, and now turned around and have to stand before their constituents and say, hey, brace yourself for a crime wave. Are you kidding me? That is absolutely ridiculous. And we can look after the safety of our inmates, our first responders, our detention staff, and we can also bring a common sense approach on how we take care of the inmate populations moving forward. There is a way to do it. We've done it. And so again, I think the one thing I would leave our listeners to is that there is a place for reform. There is a place for mental health and substance abuse treatment so that we can make a dent in that overpopulation of individuals, especially our women. And I've seen it done. And, as a Republican, I would tell you that we have spearheaded talks on what would be considered liberal things like diversion programs. We spearheaded the movement to get legislation to allow counties, in cooperation with law enforcement and the district attorney of that county, to provide for diversion programs for those people that are being arrested because they're addicts, and diverting them to the proper treatment. That's common sense stuff. But on the flip side of that, we have to remember accountability. And so we have to set guidelines. And I would tell you that in a diversion program, we would give you 3 to 4 times to go back and get that treatment, because we know that addicts don't just go to treatment, right? And provided you're not committing violent crimes or crimes that are affecting our law-abiding citizens, we want to give you that opportunity. But at some point, again, we can't let go of accountability. And we can do both. It's absolutely possible. It's going to take partnership. It's going to take us all setting aside the political components of these very complex situations. And also, it's going to take our politicians from doing the knee-jerk decisions and reactions that bring instant gratification and not long-term solutions. So anyway, thank you for letting me be here today. Thank you.
You just gave us a brain full there. Thank you. Speaker Steele, I'm going to give you the final word.
Sorry, I got on the soapbox. I'm off it now, though.
No, very, very good. I'll be very quick. Sheriff, it's an honor to get to have this discussion with you. And Wayne, I wanted to say thank you again for including me. I truly appreciate this opportunity. So many things that I agree with what the sheriff said. The one thing that I would sort of take exception to as a fellow Republican sheriff is that I do not think diversion programs are liberal in any sense of the word. It is the most conservative thing that we could do to make sure that we are utilizing the resources that we have available in an effective way to actually accomplish the goal of reducing crime and increasing public safety. And as you said, addressing those core issues of addiction and unresolved trauma and untreated mental illness gives us the best chance of actually increasing public safety and improving the quality of life for Oklahoma. And I think that that's a very conservative thing. A couple of things that I would just underscore is that I think there's some lessons that we need to study. I think there's some conversations that we need to continue. The reality is, overall, arrests are down in light of the pandemic, and so is the crime rate. Property crime continues to decrease. And, you know, going into this pandemic, the thought was if businesses close and are unattended, there may be an increase in crime rate or property crime. We haven't seen that. We've seen right the opposite. I think people, for the most part, are staying at home. That doesn't mean that that's going to continue once the economy opens back up and things return to normal. But I just wonder if we could learn some things about engaging in fewer arrests and working harder to divert people away from the criminal justice system, if that might not give us a better chance to actually save some lives. And then in addition to that, I just want to agree and validate and underscore what the sheriff said. We must invest in treatment, in access to mental health treatment, in substance abuse treatment, in counseling services for people who have experienced trauma. And I think we also need to have a very serious conversation about effective strategies to reducing domestic violence in the state of Oklahoma. I think that that's something that sort of has bubbled up to the forefront in light of this pandemic. And I know that we have some incredible providers in the state of Oklahoma, Divis in Tulsa, YWCA in Oklahoma City, Palomar, and others who are doing extraordinary work. But I just wonder what we could do to make sure that anyone that may be in a volatile or hostile situation at home feels empowered and safe to be able to report that. And then also to make sure that we have effective processes in place to resolve and remedy and modify the behavior that is unwanted and that is dangerous. And I think that that's a conversation that we need to continue. Wayne, the final observation that I would make is that I also have the privilege of working in direct services with men and women who are directly involved in our incarceration system. And I just don't want us to forget the importance of treating everyone with dignity and humanity and respect. Some of the most effective changes that we have incorporated have been some of the most simple. And so, for example, we communicate with individuals that we're working with who still may be incarcerated via snail mail. We're writing old-fashioned letters to communicate, to stay in touch. And I cannot tell you the impact that receiving a letter from somebody who feels completely cut off and completely isolated has on an individual's emotional well-being. And so there are so many things that we can do to continue to work together and to help each other and to ultimately raise our standard of living within our state. And I think together, as the sheriff said, there's room to continue to improve, to continue to learn, to make sure that we are making the best use of our state's resources and that we're helping all Oklahomans reach their God-given potential. And again, thank you so much.
The wisdom of Solomon issue that you both are pointing to here is distinguishing amongst the population of people who are arrested and convicted between that group that are treatable, educable, employable, and taxable, quite frankly, from those who are dangerous and need to be incarcerated for public safety purposes. And that is a wisdom of Solomon sort of situation that's not made any simpler by a global pandemic over the top. Listen, I want to thank former Speaker of the House, Kris Steele, Executive Director of Oklahomans for Criminal Justice Reform, and Tulsa County Sheriff Vic Regalado for joining us today. You've helped us understand a challenging situation and let us see some important public policy alternatives that are available. Thank you to our viewers and to the sponsors of our town hall, the George Kaiser Family Foundation. Please join us again next week for our next Tulsa World's Let's Talk virtual town hall featuring Susan Neal of Gilchrist Museum and Keith Elder of the Tulsa Symphony Orchestra, who will be talking about the fine and performing arts communities, how they've had to address the challenges of the COVID-19 pandemic, and the importance of art in our understanding and in our dealing with the challenges of isolation. I'm Wayne Greene, editorial pages editor of the Tulsa World. Goodbye for now.